This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Enter the
Supposed to
second.
help first or
Medical Dilemma.
Hi ladies and gentlemen, you're tuned in on GNN and you are watching Medical Dilemma. I'm Attorney Sarah Jane Sugitan, your host for today. Today we're going to discuss a female, especially our female viewers who are concerned with this or may have this strange disease, as our guest would put it. Our topic for today is endometriosis, and we will also touch on myoma later on. And we have as our guest Dr. Albert O. Madrilejo of the Asian Hospital and VR Potenciano Medical Center. Welcome to the show, Dr. Madrilejo.
Thank you, Sarah, and I would like to greet our viewers and staff of this company. Welcome to the show.
Yes, doctor. Let's go straight to the point. Endometriosis, doc. This is a disease that affects women in general because can you define what endometriosis is for us?
Okay, Sarah. For me and maybe for my colleagues, endometriosis is a strange disease condition that affects women the moment they have their menstruation, maybe at age 13 or 14 years old, up to the end of the reproductive years, up to onset of menopause.
So as young as even 13 years old, and ngayon nagre-regla, doctor, minsan 9, 10 years old, they can already be at risk of this disease.
They are predisposed already.
Predisposed.
At risk. There are many risk factors, predisposing factors, but this endometriosis, as you have asked me earlier, you know, the endometrial tissues, which is inside the womb or the uterus where the baby is, every time they menstruate, sometimes these tissues or endometrial tissues would be outside the uterus. They can be situated on the urinary bladder, rectum, colon, or even up to the diaphragm. And every time menstruation comes, they also bleed. So they are islands of tissues from the endometrium, from the uterus, which they should be contained inside the uterus and not outside the uterus.
So as you said, these are islands of tissues that are parang spread out, no, doctor? So it's not just in the uterus, it can be outside and as high as the diaphragm, not only in the reproductive area of a female.
It can spread also to other organs of the body of the woman.
But these endometrial tissues are naturally occurring. I mean, is that something that we produce? I mean,
No, endometrial tissues are the glands, the lining of the uterus, which can be found now as islands outside the uterus, wherein they should be inside the uterus, but they are now occurring outside. And there are many causes as to why they are outside. We cannot definitely understand up to now why their behavior is like this. The most common theory, medical theory in textbooks, would be Sampson's theory, way back 1927, wherein every time a woman would menstruate, some of the tissues and the blood and the menses will regurgitate back to the fallopian tubes and get implanted on the uterosacral. The uterosacral ligaments are the ones that hold the uterus, and then they can also implant on the ovaries, and they can also implant on the urinary bladder and rectum. The other theory would be the coelomic metaplasia theory, wherein the lining metaplasia undergoes metaplasia. The peritoneal cavity lining would transform into endometrial-like tissues. A third theory would be sometimes we think of the Mullerian theory, wherein at 8 to 10 weeks, when the embryonic development of the fetus occurs, when the reproductive organs migrate toward its sites, it leaves some sort of stem cells, wherein they become alive when the menstruation comes or when estrogen comes in towards teenage life. There are other theories. It can also spread through the lymph or to the blood vessels. That's why I told you it can spread even up to the lungs.
Up to the lungs.
So what happens every time
The
the woman will
woman
menstruate,
menstruates.
but these are rare cases, the patient might have pneumothorax.
Which
And
is,
it is an emergency wherein there would also be menstruation of the lungs.
so there will
And
be
you have to
bleeding.
put a test tube, a tube, chest tube, and aspirate the blood or drain it.
Drain
So,
the
but these are very,
Very
rare
rare.
cases.
Okay, Dr. Badrilejo, no? So let's take it step by step. So a young female, once the onset, she has the onset of menstruation, is already, as you said, maybe predisposed to endometriosis already. But is this, what does an endometriosis look like? Is it a bukol, ganon, or is it a mass?
Okay. What really happens would be these islands of tissues which were placed outside the uterus by those theories or by unknown theory, which we still do not understand. Every time estrogen comes, because of the ovaries, when there's a developing egg, they grow, they multiply, and when there's no more hormone, you menstruate, and they also bleed. So just imagine it like you have a cut wound. When you have a cut wound outside on your skin, your immune mechanism would heal that wound.
That wound, yes.
There would be scar tissues. So what happens? It's similar to what happens inside the abdomen of the woman. There would be scar tissues, there would be adhesions as manifestation, and so this can be seen as bluish spots, whitish spots, or reddish spots, but sometimes they're microscopic.
They're microscopic, so they cannot be
They
readily
cannot be seen, yeah.
Okay, Doc. So, meron po bang symptoms? Are there symptoms that we women have to look out for, like danger signs to check if we have endometriosis?
Okay, I said earlier again that endometriosis is a strange disease because there would be women who would have severe cramping, dysmenorrhea pains.
Is that not normal, Dr. Madrilejo?
Oh,
That
it could
is-
be normal, but then it is subjective also to your threshold of pain. But then
That's true.
some women would have severe pain, but when you
Yes.
investigate on them, they don't have endometriosis. Some would have very little pain or no pain at all, but endometriosis is what? Stage 3 or stage 4, and that is the severe case, the severe stage. So it's very strange. Sometimes you don't see it, sometimes you see it, sometimes it does not go together or synchronize with the pain. Well, it's good if the pain is there. Usually it's progressive pain as the years go by. And it's nice if you can see the endometriosis, the endometriotic cyst, but this is the number one symptom. The other symptom, which I said earlier, would be, since the most common site would be the uterosacrals, which holds the uterus, during sexual activity of the woman, there would be pain.
So-
Because every time there's sexual activity, the uterus would move. And what holds the uterus? The uterosacral ligaments. And if there are endometriosis, there are scar tissues, then you will feel pain.
Pain.
So that would be the second
Symptom.
symptoms or signs. Of course, the third, we're talking about the most common, would be infertility. The woman just doesn't get pregnant. We have seen women with severe dysmenorrhea,
Yes.
stage 3, cysts in the ovaries, and they do get pregnant.
They still
Then
get
we see
pregnant.
Some women with no signs at all, slight dysmenorrhea pain, but they don't get pregnant. So you have to investigate now. So the third part is infertility.
Fertility.
Yes.
So despite regular intercourse, if the woman and regular menstruation, then the woman cannot does not reproduce, then that can also be a symptom of endometriosis.
Correct, yes. So it's, again, pain, dysmenorrhea, pelvic pain. Usually it's progressive.
Pelvic pain, doc, sa puson?
Yes,
or-
usually here in front or at the side and at the back, up to the rectum sometimes. And then there's pain on sexual activity. We call it dyspareunia in medical terms.
Dyspareunia.
And the third would be infertility.
So, but the pain, doctor, does it have to occur during, the first symptom, I mean, does it have to occur during menstruation, or it can be like just a recurring pain in the pelvic area?
In some patients, it's always there, especially if they have endometriosis. Any movement of the intestines, scar tissues will be stretched. There would be pain. But usually, in all textbooks, more or less, and my colleagues would agree with me, it occurs just before menses, during menstruation, and a few days after menstruation.
Oh, so the pain does not go away because, as I said, the scar tissue,
The scar tissue
tissues
is
are there,
present,
yes,
yes.
and they get moved around and all these things. No, pero doc, how do you diagnose? Do you need to have an ultrasound to detect endometriosis or surgery, or ano po bang ano niya? How do you detect endometriosis
Okay.
apart from the symptoms?
Sarah, detecting or diagnosing endometriosis would be, well, you want 100% detection of endometriosis on a patient, if there's presence of pain and all these things, you can do a laparoscopy. Diagnostic laparoscopy. Definitely it's 100% accurate.
Accurate.
But sometimes you don't see anything in laparoscopy.
Despite the laparoscopy, kasi
So-
hindi lang ultrasound, doc. We're talking
Correct.
talagang you put a
Yeah.
microscope
So,
inside.
you put tubes, scope, camera, and then if you don't see anything, well, it's good if you see it with your own two eyes. But then, still, you have to get tissue samples of it. And if you don't see any evidence of endometriosis, you bite on the peritoneal lining because sometimes it might be microscopic.
Wow.
So,
It can
you
be
can-
that small, doctor?
it could be that small. So it could be, well, it would be nice if it would be big cyst, easily detectable, but still you've got to have a biopsy. So golden rule, 100%, diagnostic laparoscopy. We would do a transvaginal laparoscopy, which is easier. The laparoscopy is passed through the vagina, cul-de-sac. You can do a transvaginal ultrasound. You'll be lucky if you find some cyst or some areas, but you know,
The accuracy is
there are
still
4
like-
stages of endometriosis. If it would be stage 3 or 4, then you're lucky to see some cyst.
It will be visible
On the transvaginal
at the,
ultrasound.
at the ultrasound level.
The third, which might or might not be helpful, would be the CA125
Exactly.
hormone that you get on the blood of the patient. But
it's
it's
not,
not that helpful. Still, the golden would be the diagnostic laparoscopy, abdominal, or transvaginal laparoscopy.
Okay, Dr. Madrilejo, when we return, we'd like to discuss the treatment and eventually the medical dilemma that arises from diagnosing and treating endometriosis. When we return right here on GNN, please stay tuned.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?